Charities, universities, and GPs warn that national insurance tax rise will hit jobs and services. We're going to read into this more from the Financial Times, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from the Financial Times with the headline that charities, universities and GPs have warned that national insurance tax rise will hit jobs and services. The funding boost will be wiped out by the cost of meeting higher employer levy, said contract service providers and education bodies. Guys, while you're here, make sure you hit the like button and share it across social media so others are notified of this video. Now, for those who have been following me and my watching of the budget, the overall view I thought it was a good budget. However, while I still think it was a good budget, there is obviously this tiny little problem that businesses and employers are going to be hit the hardest here by this budget. They are getting hit the hardest, and I always said it should have been the richest and the wealthiest in society. And don't get me wrong, some of the wealthiest in society are getting hit by this budget, but nowhere near enough. And unfortunately, as much as the Labour government has said that they would not increase tax rises on working people, they technically have through the increase in national insurance in employer and not employees, because their intention was to protect working people. That was the intention. If you're working class people, they're supposed to be protecting you. But some of the decisions that have been made in this budget may actually come back to bite them. It may not bite them straight away. It may bite back at them down the road. But this is one of the biggest budgets that we've one of the biggest ground shifting budgets that we've had for a long time, because it's a Labour budget as well. We've not, I've had a lot of tax cuts here and cuts here and there. And while there have been cuts in some departmental levels, there's been a lot of borrowing and a lot of to improve investing and a lot of money being put into public services. While it's also at the same time some of it is having to be taken, some of it is bounced back, as say forth. Now, when charities, universities, and GPs are warning about the troubles that are going to be hit, that's very cause for concern. Now, I will say, obviously, things will take time to see how things turn out. I'm not saying at all that this budget has been perfect. It has its flaws, but it does have some good stuff in it as well. But I think, when you've got organisations, and especially those who in the know-how are saying how this is going to impact them, we should take it very, very seriously. That is for sure. So let's read what they've had to say here. So GPs, health and social care charities and universities have warned that Labour's decision to raise employers' national insurance contributions will lead to job losses and reduced service as the extent of budget tax rises become clear. Now, why would they say that? So by putting the emphasis on employers' national insurance contribution and not employees, those businesses will know, unless they're prepared, the businesses themselves are prepared to take a hit, they will have to find the costs for that somewhere else. Yes, you are still raising a huge amount of money for the taxpayer, for the Treasury, but that money has to come from somewhere. And not all businesses, some businesses will take the hit. Some businesses may take the hit, but there will be some that won't take it. Now, there are some exemptions from certain small businesses and certain thresholds. I don't know certain thresholds, I believe, but some medium and large businesses, rather than them taking the hits themselves, some of them will likely do is they will pass it on to the consumer, or raise prices of their goods in order to offset the cost. So while the Treasury will still get that money, that money has to come from somewhere, because, as you guys know, you can't magically make money appear. Well, you can. The Treasury can print money if they wanted to, but it's not really a good idea. But it has to come from somewhere, that money. The government set aside about $4.5 billion to cover the cost of the increased national insurance contribution for public sector workers. But it has not exempt third sector organisations such as charities, the provided contract service to local authorities, and the NHS. Yes, so I saw this I've read this in one or two places as well. So private healthcare, so specifically there are some private healthcare services that are funded by the NHS that provide services in certain areas across England and Wales, provide services to people. And by obviously, and this can impact some of those services, which could mean that those services will be even less, or maybe less workers, which means that you will have less healthcare potentially as a direct result of this decision to raise employees' national insurance, apparently. So I have read that in a few places as well. I'm not saying it will in all places, but there are some rural areas that it may potentially affect. So Health Secretary Wes Streeting conceded on Thursday that some healthcare providers would be affected by the policy, which lowered the threshold at which employers would start paying the tax on each employee's salary to $5,000 from $9,100, and increased the rate of 1.2% points to 15% from April. Care groups have warned that the extra £600 million allocated to the sector in the budget will be wiped out by extra costs incurred in the tax. The National Council of Voluntary Organisations said it's estimated that the changes will cost charities $1.4 billion, and that's as it is writing to the Chancellor to request an exemption from the sector. I do think charities should be exempt from this. Right now, they are, at the moment, the government, this government at the moment, needs to obviously get people back on their feet. But what we don't want to do is punish the charities that are keeping people alive right now, that are literally holding people up. Because that's what a lot of volunteering and organisations of charities are doing. And we want to make sure that they are protected. So I do think they should be exempt from this. Rodigan Hughes, the chief executive of VOGD, a membership organisation for more than 100 disabled charities, said smaller memberships were reporting salary bills increases of £300,000 a year and larger ones of over £3 million and £4 million. The Cheshire-based David Lewis charity, which provides educational, residential and medical services to young people with learning disabilities, told the Financial Times estimated that the budget changes, including an increase to the minimum wage, will cost it an extra £1 million a year. John Heritage, chief executive of David Lewis, said the changes meant the charities would have to either trim its investment plans, raise prices, or give up providing some services, or a mixture of all three. Yeah, this is the fear of what some charities may have to do. For us, we've suddenly been hit with a £1 million extra cost, which we haven't budgeted for, and there is no indication of how it's going to be covered, he said. That will increase the cost of local authorities of what we do, and it's a completely false economy. Following uncertainty over how the GPs, which tend to be run as small businesses, would be hit by the policy, the Chief Secretary to the Treasury, Darren Jones, told BBC Question Time show on Thursday that they would also have to pay employer national insurance contribution. GP services are privately owned partnerships. They are not part of the public sector, he said. They will therefore have to pay. Ed Davis, leader of the Liberal Democrats, said hammering small businesses with a tax hike is the wrong choice. It will hit people's wages and jobs, but also risk worsening the NHS crisis by hiking costs for care providers and pushing some to the brink. The university sector has also warned that raising employer national insurance would force institutions, many of which are already cutting back on staff in order to address sector-wide financial pressures, into further retrenchment. Analysis by the University of College Employers Association found the cost of the combined changes to employers' NI would add up to around $372 million, equivalent to 2.1% of the sector's pay bill for 2024-2025. Raj Jedwar, the UCEA chief executive, warned that institutions would face difficult decisions to balance their budgets as higher costs are landed at a time of falling student numbers and a stagnant fee income. Sir Steve West, Vice-Chancellor for the University of the West of England in Bristol, said that the NI increase would add to about $4 million to the university's annual salary bill of $260 million at a time when it is already introducing tight cost controls and pausing non-essential investments. So they're already squeezing themselves, and now they're going to have to squeeze even more, some of them. This just adds to the pain that we're already managing. Last year, we cut expenditure by $60 million. This year will be a further $20 million, and we're looking at another $22 million for 2025-2026. This measure puts further jobs at risk, he said. Vivian Stern, chief executive of University UK, the sector lobby group, said many other universities have reported similar positions, with one institution in the north of England predicting that the national insurance rise would add another 60 to 70 jobs to existing cuts. Not good signs at all, guys. Not good signs at all when you think about it. But there is going to be some pain from somewhere. There was never going to be, they did warn. Labour did warn in the run-up to this that there would be pain. They did warn there would be pain. Now, am I saying it's right that Labour are doing this? No, I don't think it's right. I do think that there are plenty of other ways they could have raised funds. In my personal opinion, there are many other ways. The wealthiest could have paid much more tax or taken one lump sum rather than hitting national insurance employers, if I'm honest. But the government is making this decision, and it's a brutal one to some, but for others, it's a necessarily one to them. I generally just don't think it's right that any middle or low incomes who are struggling right now. The majority of the burden should be facing on the highest earners. Really, really should. The highest earners, those who are millionaires and billionaires, just asking for just not enough being taken from them. And this premise about them fearing of them leaving is absolute nonsense. You know, they get it so much easy here in the UK already, and they can easily afford to give a bit more. I generally think this was not the case. Yeah, but I do fear in particular for charities, because charities they are really important organisations, that is for sure, guys. But what do you guys think? What do you guys make of this story from the Financial Times? What do you make about universities, GPs, and other jobs and services that are at risk and are going to be squeezed even more as a result of this decision by the Chancellor to raise national insurance employer? Let me know your thoughts and more down in the comments section below. If you found this video informative, please hit the like button. We greatly appreciate. Share it across social media so others are notified of this video. If you haven't subscribed already, please consider subscribing, because it really does help support the channel. If you want to go one step further and financially support me in the work that I do here, you can do so by becoming a YouTube member for as little as 99p, or join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching, and I hope to catch you all very, very soon.